Hi everyone. Today I want to talk a little bit about coronavirus and nursing homes. Our firm has taken a leading role in pursuing nursing homes who were negligent with respect to the spread of coronavirus. And I first off want to make sure it's understood that not every instance of a person contracting coronavirus in a nursing home is legally actionable. So the issue is going to be whether or not the facility met standard of care with respect to preventing the spread of coronavirus. So a nursing home facility of any kind, and I'm using nursing home kind of loosely to cover any long-term care facility. A long-term care facility is not responsible for ensuring that no patient gets coronavirus or tests positive. That's not what their responsibility is. But they are responsible for taking reasonable steps to prevent the spread and to prevent infection. And this really isn't any different than what their responsibility is anyway. So, with respect to residents normally, so pre-pandemic, long-term care facilities had and have a responsibility to take reasonable steps to prevent things like falls, wounds, pressure ulcers, infection issues such as urinary tract infection, for example, pneumonia, things of that nature. So it's always the case that these facilities have a responsibility to take reasonable precautions with respect to these issues. Doesn't mean they have to prevent them all. It doesn't mean that bad things won't happen anyway. But they do have to take reasonable steps. And really, the coronavirus is no different in that sense. It's different in that it is not something that we as a society have been confronted with before on this level, but it is not different with respect to the fact that nursing home, long-term care facilities, staff and personnel and management working in those facilities had an obligation to take reasonable steps. And reasonable is the key. And the way that the fact that we're dealing with sort of this unprecedented pandemic is going to play into this litigation is what does reasonable mean? So with some of these other issues that I mentioned, like pressure ulcers and falls, things that are common in the long-term care setting, it's pretty well established what reasonable means with respect to taking appropriate precautions and interventions. It is likewise well established what reasonable means with respect to preventing the spread of infection. And, arguably this is a type of infection in that sense, a type of contagious infection. Scabies is an example of every so often we see long-term care cases where there's a scabies outbreak and there was a failure to take reasonable precautions. So perhaps with respect to the contagious aspect of it, you can liken it to that sort of situation. So what's going to be, challenging, I think, for both sides of the fence in this setting or scenario is that the reasonableness in terms of what should have been done and when it was done is a lot more up for debate than some of these other more solidified issues that we've seen in long-term care facilities. But there's no question that reasonable steps needed to be taken. And so the issue is, and this is going to be facility specific and even patient specific in some ways. We look at a case, we look at the facility and what we know about what steps were taken or were not taken, when they were taken, for example, as well, because as this was an evolving thing, I think, standard of what was required sort of was a moving target in some respects. So, when certain precautions were implemented is an important factor as well. So that's what we look at when we're determining whether or not there is potential liability. It's not the mere fact that a resident or even, multiple residents test positive in a facility. Though certainly, having multiple positive tests should or could, I suppose, show us that there is likely to be a lack of reasonable steps taken, because you would think that if reasonable steps were taken, then sure, bad things can happen and people can test positive, but it's unlikely going to be over and over and over again in multiple people, dozens of people, in some cases even almost the whole facility that would tend to suggest that perhaps reasonable steps were not taken. So those are some of the things we're looking for. That's all for today. See you next time.